Now to our top story tonight. Low barrier shelters. They give people a place to stay without requiring criminal background checks, IDs, or income verification. The shelters also do not require people staying there to be sober. They provide an option for people struggling with addiction and homelessness. According to the nonprofit Preble Street, Maine has 5 privately owned low barrier shelters. 3 are in Portland, 1 is in Waterville, and 1 is in Bangor. Hope House is the shelter in Bangor and has been at the center of discussions for months. Preble Street in Portland is planning to take over the shelter by February 1st.
The move keeps the shelter from closing. News 3's Katie Delaney has more.
The announcement comes a month before PCHC said it would close the Hope House if it couldn't find a new owner due to financial shortfalls. Now, Preble Street says it's close enough to having the funds to soon take over operations.
It's the second largest shelter in the third largest city in the state, and we're in a homeless crisis. So of course we said, yes, we'll try. Let's work on this together and see if there's a way to keep it open.
Dozens rely on the Hope House for shelter each night. And if closed, many of those people would have nowhere to go. It's the only shelter in the area that doesn't require a background check or sobriety.
So keeping it open, I think, is strategically really important, as well as just meeting the need.
The Maine legislature is providing $500,000 annually to the Hope House over the next 3 years, helping to make this transfer possible. PCHC's president Lori Dwyer said at a Bangor City Council meeting she's excited about the transition.
It's just a win-win situation for the community and for the populations that we're serving.
Community organizations that work with unhoused people like Bangor's Health Equity Alliance recognize the impact that resources for these communities have.
By housing the right folks at the right time, we can increase the flow through our homeless response system. We can increase the number of times a bed turns over. We can increase the number of people who exit safely to permanent housing.
Preble Street Executive Director Mark Swan says they're still working to raise another $100,000 to fund Hope House's operations.
I have optimism. If I thought this was going to fall off a cliff in 3 years, we wouldn't be doing it. We're in it for the long run.
PCHC and Preble Street are still working on a contract with the Department of Health and Human Services. Swan says he's expecting the deal to be finalized in the next few weeks. In Bangor, Katie Delaney, News Center, Maine.
Penobscot Community Healthcare will continue running the Hope House until the transition is finalized, which is expected to be early next year.